Yeah, I think I covered everything. I think I covered everything on this slide, so we can go on to the next one. Yeah, that's it for my part. Thanks.
Okay, thanks, Bethany. All right, so she went through the majority of the essential portion of the training, which is the data collection. I'm going to now go through the clinical volunteer training. Again, this will be given to you in greater depth and in greater detail the day of your clinic. So we're just going to get started with vaccinators. So you'll administer the vaccine after the data collector has completed the screening and entered all the vaccine recipient information into the database that Bethany just went over with you. You'll tell the data collector that the vaccine administration site for the patient that you administer the vaccine to, and you'll give them they should know your name since they'll be working with you that day, but you'll also make sure that you give them your name, and they'll log everything into the system. Provide health passports as requested by patients. We will have this on site, but people rarely ever ask for them, but they will be available to you if you need to provide them. The medical operations lead will routinely rotate medical staff among vaccinator and drawer roles. This is kind of a null and void point for this year. All the syringes and everything like that will be pre-drawn and then provided to you. So you won't have to, as a vaccinator, you won't have to draw the vaccine yourself or worry about any of that. We'll be bringing around, or the supply runners rather, will be bringing around the vaccine in cool cubes for you. So we'll just go ahead and do it that way. So again, any and all supplies will be provided to you, so you won't have to seek anything. Everything will be brought to you. We've already kind of gone over this, but as clinicians, it's important for you to know that we're not vaccinating anybody under the ages of 9. You'll be administering the Flucelvax quadrivalent. I'm really surprised that I was actually able to say that this year without stuttering. And again, the dosage and everything like that is provided for you here. I believe that this number of doses purchased by LEHB will be updated, but last year we had over 3,000 doses to provide, and I'm sure this year will be quite similar. This vaccine specifically does not contain egg protein or okay, that one got me, but it does not contain either of those. So you don't have to worry about anything like that. And the data collectors, again, will go over the screen questions with the patient, so you don't have to worry about this anyways. All right, for the route, all vaccinators and all clinicians know when you're providing a vaccination for an inactivated influenza vaccine, it'll be injected intramuscularly with a needle and syringe. You'll shake the syringe vigorously before administering, and here's just some visual representations of what you'll be expected to do. Again, we'll have a med lead on site for you all to go over specifics about this. If you have any questions or if anything pops up, they'll be able to answer that for you, or just kind of clear up any confusion if you have any, but it's pretty straightforward. All right, so do's and don'ts for the drive-through. Again, if a vehicle approaches, do not approach that vehicle until the ignition is turned off. When you enter you never enter a vehicle to vaccinate someone. That is a no-no. If you, for some reason, cannot reach that person because the vehicle, if for some reason, is tall, like a big truck or something like that, we will have a stepping stool for you guys to kind of get up on, or we'll ask that patient to get out, but that rarely ever happens. We just want to stress that you are not to enter the vehicle. That means do not lean in the window of a vehicle to vaccinate. We want you to be comfortable, so we don't want you as the vaccinator to shift your position in any way to accommodate the patient's convenience. That patient should shift themselves to accommodate you as the vaccinator. Having a conversation with anyone who's not a mask. This was very big, when COVID was a thing, or a big thing, I should say. I believe that we're still asking patients to arrive wearing masks. However, we will have extra on site to provide for them, but COVID is not our main concern this year, thankfully. We will ask, again, staff to vaccinate or to mask, but while you're vaccinating, if someone does have a mask, please, or if you see that they don't have a mask, please ask them to put it on. But that's, it's not a huge thing like it was the last 2 years. No one should cross traffic lanes while vehicles are moving. I stressed this a lot throughout this training, but there is a There's a risk when moving through lanes because cars will constantly be moving back and forth. So again, just be cautious and aware of your surroundings when moving through those lanes. And then again, call or raise that card for the syringe or supplies or anything else that you may need. If you need data collection assistant or anything like that, just raise that red or green card and someone will be over to assist you. And just don't go out and get vaccines or any of the supplies yourselves. They'll be brought to you. You are able to put, Rona did give me the go ahead and say that you could put vials in the sharps containers this year. But it should just be syringes and vials. Nothing else should be going in the sharps container. There will be a biohazard bag at your vaccination station and also a regular trash bag as well for you. All right, so the do's, you know, have the patient again accommodate you instead of the other way around. Make sure the patient's arm is positioned appropriately for you to administer that vaccine. Using stepping stool if needed, as I mentioned earlier. These are basically straightforward things. Move in sync with your team members. All this should come naturally, but I just wanted to make sure that I kind of express this to you all. Remain in the safety zone until told otherwise, you know, things like that, but pretty straightforward, simple. All right, to glove or not to glove. So OSHA has said that you are able to glove. You are welcome to glove if you would like to, but it's not required. If you do not decide to glove, in between patients, you do have to hand sanitize. You should be hand sanitizing in between patients anyways, but I just wanted to highlight this for you all. But again, Rona or whoever the clinical lead on site will go over this specifically with vaccinators. Contraindications. At the clinic, do not give a vaccine to a patient, again, if they're under the age of 9, currently has any acute febrile illness, or has had a severe reaction like anaphylaxis or anything like that in years past. This is why data collectors and vaccinators, you have to work together to make sure that the screening is done appropriately and correctly and that you're not missing anything, because we don't want anything to slip through the cracks or any of these things to happen when they shouldn't. But if you are confused or if anything comes up and you're not too sure, you can always flag someone down and we'll be able to answer that question for you or provide clarification. Precautions. All right, so these are just some of the things that Rona asked me to share with you all. If at any point you have any questions about anything on this slide, feel free to ask them at the end of the training or the day of your clinic. But if you need assistance with anything pertaining to this, you can always raise your red card. Again, there'll be a red and green double-sided card to raise that red card for the med ops lead or the clinical assist to come and assess the situation or speak to the patient or whatever you need. Potential reactions to the vaccine. So as clinicians or vaccinators, you know that everyone reacts differently to any type of vaccinations. There could be, you know, red pain or anything could pretty much occur when you administer someone a vaccine, but you want to just be aware of these things. And I do just want to stress while we're on this slide, we will go over your scope of practice and cover anything that may have been, you know, that may be confusing, or we'll provide clarification for anything that you may have questions on. But this is just something that I just wanted to share with you all. If there is anyone with like an immediate allergic reaction, including hives, you know, anything like that, immediately notify the med ops lead or the clinical assist, and we'll get that situation settled and handled appropriately. I've already kind of touched on this. I'm not going to drudge on this too much, but again, you know, needles, syringes should be the only things really going in the sharps containers. I was given the go ahead that you guys can put the vials in the sharps containers as well this year. But again, we will have biohazard bags on site at your vaccination stations for you. But please do not close the sharps containers. Do not close the sharps containers. I'll say that again. Do not close the sharps containers. We will have someone either come do that for you or instruct you to do that when it's time to. But that is something that we want to just stress to everybody. We will take care of that for you or instruct you to do otherwise when the time is necessary, but do not do that ahead of time or unless told to do otherwise. All right, so the role of the vaccination or the vaccine station assistants is pretty simple. For the drive-through, you guys will be handing supplies to the vaccinators as needed, unwrapping bandages and ready materials to ensure a smooth experience and kind of keep with the consistency and the easy flow of the clinic. You'll monitor supplies on the table. And again, if you notice that anything may be running low, you'll just flag down a supply runner. They'll bring you anything that you may need. And we always encourage PPE use as needed. Masking, again, will be required for staff, but if you would like to wear gloves or anything like that, you're welcome to. We'll have gowns as well and facial masks available for all staff members, but that is up to you if you would like to use that extra PPE precaution if you would want to. As I mentioned earlier, all the vaccines, all the syringes will be pre-filled for you and they'll be pre-drawn. You won't have to worry about any of this. We'll take care of pretty much everything for you. We like to make this as seamless as possible. So we just want to make sure everything is straightforward. It will bring you everything that you need. But the goal is to maintain the sterility of the syringe. So this means, Rona wanted me to kind of to touch on this, that you are not to place the needle on a chuck, even though the chuck's supposed to be a sterile environment. She just asked that you not place any open needles or uncapped needles or syringes on the chucks, because then they become unsterile and we're not able to use those. Also, again, as clinicians, you should know kind of the tips and tricks when vaccinating, but we do like to keep the vaccine or the syringes covered, out of the light, things like that. For the drive-through clinic, it may get a little windy since we are under that little tunnel. So we just want to keep everything on the table and the vaccination station secured. So just be mindful of all of that. And we'll go over all this again the day of your deployment. Set up and maintain the environment. So this is pretty straightforward. We're going to it's kind of impossible to have a quiet area at a clinic like this. So it may be a little bit noisy, but it's important for you to be able to hear the patient that you're vaccinating. If it becomes too noisy, or if you have a patient that needs a little extra assistance or that needs a quieter space, please just let us know. We're able and we're happy to accommodate patients to make them as comfortable as possible. Of course, you want to use clean surfaces, make sure that everything stays sterile or pertaining to your chucks and anything like that on the vaccination table. Again, you're going to wash and sanitize your hands in between patients, or, even as data collectors throughout the clinic. Cover the surface with the clean chucks. Everything else is pretty straightforward. And then you're going to make sure that all of the vaccinations that you administer are recorded, which they will be by your data collector. Again, I'm not gonna dive too much into this because the clinical assistant and the med lead on site will go over all of this with you again the day of your deployment. So I'm just gonna kind of skim through this one, but this is pretty straightforward for both of the clinics that, if you're deploying to both of them or either one, this is what it will be for both of them. So just some tips. And other good practices. We touched on washing your hands a lot. I already spoke about, no food or drinks or cell phones or other personal items on the chucks or in the vaccination area. You can glove or not glove, it's up to you. Your next deployment update will be this Thursday on September 29th. I will send out updates for the October 1st clinic and the October 12th clinic pertaining to your specific job functions. I will also attach job action sheets for your specific assignments for each of those clinics. And if you have any questions about any of this, you can always contact me at mrc@phila.gov. If you have my telephone number, you can feel free to text me as well, or leave me a voicemail if that's easier for you. It is 215-789-5333 for anybody who may not have that. Again, it's 215-789-5333. And I will also put my contact number in your deployment update as well for you. Sorry, I forgot to add animations to the end. That is it for my spiel. Does anybody have any questions for me at this point? If you do, either you can drop them in the chat if that function is working, or you can unmute yourself and ask any questions that you may have. Other than that, I will remain for a few minutes to answer anybody's questions. And I just thank you all again for joining this training this evening. I apologize for any hiccups and the technical difficulties that we experienced, but I do appreciate your volunteerism, and I am looking forward to seeing everyone at both of the flu clinics, whether you're working one or both. Your services are greatly appreciated, and we could not do these clinics without you. If you didn't know, this was 99% staffed by MRC, so You are an essential part of our workforce, and we just appreciate having you all. All right, so I'm going to open the floor for any questions. If not, I will see you all on either Saturday or next Wednesday, the 12th. Thank you. I hope you have a great evening. Thank you to everyone in the chat. I appreciate you. And I, again, will be sending out the recording probably tomorrow or definitely by Thursday when you get your other deployment update. Yes, I will, because of the technical difficulties, I will be attaching the full PowerPoint to the deployment update that I'll send you guys, just so you can look through the slides on your own. And if you have any questions in the meantime, you can always feel free to reach out to me and we'll get you those answers and clarifications. It's okay if you missed, portion of this training. I will send out the full recording from both halves, and I will also attach the PowerPoints. So again, if you have any questions at any point, you can always feel free to reach out to me, and we'll get you those answers. Thanks, and I'll see you Saturday. One thing I can't believe I forgot to mention, for those of you left on this call, is that we will be providing for the Police Training Center for the October 1st clinic. There will be breakfast and lunch provided for you. And then on Wednesday, the 12th, please just bring any snacks, water, beverages, anything you may need for that day. I believe that dinner will be provided for the 12th. All right, well, with it being 7 o'clock, I don't see any other questions in the chat, and no one else has unmuted themselves. So I'm gonna go ahead and call it a day in this training. Again, if any of you need to get in contact with me, my phone number will be listed in the deployment update that I will send out on Thursday, September 29th, along with the recording of this training and the PowerPoint slides as well. All right. Thank you so much. I appreciate it. Have a great evening, everybody.